Good morning, everyone. I'm Darrell Steinberg, President Pro Tem of the Senate. I'm joined by a number of my colleagues who you'll hear from in a few minutes, as well as some unbelievable advocates and researchers who have helped prepare the report we want to discuss here today. I want to just begin by telling you about one of my constituents, Jonathan Ramos, who was a great young man, graduated from Jesuit high school and accepted to Fordham University. But he struggled with mental health and depression issues and returned home after just 1 year at Fordham. His mental health issues became more serious. He was diagnosed with schizophrenia. He had a horrible reaction to an antipsychotic drug. And in an effort to commit suicide, he assaulted his girlfriend. With no criminal record, not even a speeding ticket, he was convicted of assault and sentenced to 14 years to life at Mule Creek State Prison. He's now on the right medication and getting treatment. And yes, he hurt someone and needs to serve time for his crime. But the indeterminate sentence, the fact that he didn't get all the help he needed that could have prevented his crime, and the possibility of him serving a life in prison as a result of untreated mental illness is inhumane. Good morning to all of you. This time last week, we were planning to announce a series of budget proposals to reduce prisoner reoffending rates, guided by the findings of a report by Stanford Law School's Three Strikes Project, which we'll talk about today. We are still doing exactly that. But these proposals, finalized earlier this month, are now cast under a different light than any of us had originally planned. It's a cruel and, of course, a sad coincidence that the significance of one proposal to improve training among frontline law enforcement to recognize the warning signs of mental illness was illustrated by a gun rampage in Santa Barbara County. And while there is a lot of focus on the shock and sadness and a search for answers, it is important that we remain mindful that 1 in every 4 Americans will suffer a form of mental illness during their lifetimes, the vast majority of whom suffer in relative silence and will never commit a violent act. The Los Angeles County Sheriff says he runs the largest mental health system in the state, and he's not wrong. Although deinstitutionalization back in the 1960s and 70s was both a humane and more effective way to treat mental illness, some seized upon it as a way to save money by shutting down the institutions without providing an alternative. And I'll remind you, as I've reminded many, if you go back and look at the typewritten archive from Governor Reagan's 1967 finance report around the Lanterman-Petra Short Act, the state promised it would fund 90% of the cost of the community mental health system. And of course, it's never come close. Here in California, we have the Mental Health Services Act, Proposition 63, designed to supplement California's core mental health system with intensive wraparound treatment and preeminent prevention and early intervention strategies. Without the initiative, California would have virtually no mental health care system to speak of. But at the same time, over $700 million annually has been cut from the core mental health system. The rebuilding started in last year's budget with a focus on crisis response and crisis care and inclusion of mental health care and substance abuse treatment in the state's Medi-Cal program. This year, we begin focusing intensely on mental illness and the criminal justice system. And the more we look at the problems in this system, the more we realize that we're just beginning to scratch the surface. These offenders are not easy to deal with. They are higher need and higher risk. But if and when we succeed with this population who cycle in and out of our expensive criminal justice system, we save money and improve lives. The Stanford report lays out 3 key priorities for addressing the callous and inhumane warehousing of people with mental illness in our criminal justice system. 1, reform the way we sentence people with mental illness. 2, provide more meaningful treatment, and 3, establish a process and criteria for humane releases. Joining me today are my colleagues, the chair of the Public Safety Committee and the Budget Subcommittee on Public Safety, Senator Lonnie Hancock, Senator Jim Bell, the chair of the Legislative Mental Health Caucus, and Senator Hannah-Beth Jackson, a passionate advocate whose district, of course, was touched by the events of the last week, as well as Professor David Mills of Stanford Law School, with whom I am co-publishing this report. He did most of the work, by the way. Along with the Three Strikes Project Director, Michael Romano. Who actually did all the work. Professor Mills will speak shortly about the report's findings, but first some broader context about the challenges facing our prison system from Senator Hancock, followed by Senator Bell. Senator Hancock.
Thank you. Thank you very, very much, Senator Steinberg, and thank you for your leadership on the subject of mental health and the huge gaps that we have in California related to that. I have to say, when I took over the Public Safety Committee, the Policy Committee, and the Budget Committee in California, I was surprised to find essentially the prisons are our new mental hospitals. And we're not preparing the people in those prisons and on the front lines of our community to deal with this problem. You can be a correctional officer right out of high school. Nobody tells you about the demographics of the prison population, how to treat mentally ill people, how to de-escalate situations. We have horrible incidents stemming from that. Several in just the last year included pepper spraying mentally ill inmates, and including one case where an inmate with a tracheotomy was pepper sprayed and died in his cell a few hours later. So we believe we need to fix this. We can fix it. Our committee has worked very, very hard with the pro tem staff and really often in a bipartisan way to put together the package that you're going to be hearing about and that this report is based on. I would actually refer everybody to page 5 of the report. There's an incredible graph that shows you what happened when funding for mental health plummeted back in the 80s and prison population rose. So we know that as the prison population rose, our prisons became so overcrowded that virtually no rehabilitation for anyone could take place. And in fact, that continued until the United States Supreme Court said a few years ago that incarceration in a California state prison was cruel and unusual punishment, and we had to take the population down. Under the pressures to do that, we are working to change the system. This package is a big first step in that direction, and we thank the Stanford Three Strikes Project, the researchers, the people who've given us the data we need to build a package that will ensure that our first responders are trained and equipped to deal with these tough situations, and that we, in fact, put the supports in place that keep human tragedies from happening every day across the state.
Thank you, Lonnie. Senator Bell.
My journey in the Assembly included, and the Senate included visiting 19 prison facilities as well as 3 of our state mental hospitals. So I have a perspective, having been there in those facilities and talking to the staff and the inmates in those facilities. And what I want to say is that, first of all, it's very clear that we criminalized the mental health system over the last several decades. It is more of a criminal act than a healthcare problem. And that's what we have to reverse. We have to trace the roots of violence in our society and look at doing programs that have an aspect of prevention and early intervention treatment to solve this issue. Our prison systems must not be the default system for our mental health system. That's what they are now. I'll just give you some statistics. The Department of Finance says we spend $59,000 annually to house one inmate. And that does not include somebody with a mental health problem in prison. It's much higher for somebody with a mental health problem. They expect this to climb to $62,000 next year. We pay more than lip service to rehabilitation in the prisons because of the budget cuts. A lot of these programs have been severely cut, and that's why the Senate, there's sort of a widespread belief that we ought to restore and renew many different programs that are recommended in the Stanford study. And we have last year started that, and this year we're going to do even more. California must make mental health and substance abuse treatment more accessible for everybody. And one of the things we're doing this year in the budgets, we're looking at the issue of mental health parity, implementing the federal law that says that mental illness and treatment of mental illness should be considered the same as diabetes, heart disease, any other kinds of illnesses. And we should integrate the treatment of mental health with other healthcare systems so that everybody can gain access. And right now, only in California, 60% of the people that have mental health problems actually have access to mental health treatment. And that's, imagine what you would say if your constituents heard that for heart disease or other kinds of health problems, that only 60% would actually get any kind of access to any kind of treatment. So we have to continue these efforts to provide treatment for all through our private insurance system and our public Medi-Cal insurance system. These programs should be available to youngsters at the earliest possible age so that we can early intervene to avoid the trauma that occurred in Santa Barbara. We need a healthcare system that takes care of kids and takes care of seniors. And we have to take care of babies because if you trace the roots of violence, some of the problems exist in terms of substance abuse, in terms of prenatal care. So it actually goes back to that level. So we need to have a system that provides mental health treatment not as a criminal act, but as a public health issue. And I want to make a statement. This is a public health issue. It's a public health crisis. We have to act now.
Thank you, Jim. Senator Jackson, you're actually going to be the last speaker here because I'm going to now introduce you to a short video put together again by the Three Strikes Project, which I hope will get not only from this event but future opportunities get wide airing here about the very subject we're talking about. And then I want to ask Professor David Mills, who is the director of the project, who worked tirelessly to help pass Proposition 36, and now with his team is working tirelessly to help assure that those who no longer have to serve these indeterminate life sentences have an opportunity to be released with the right kind of help safely into the community and get the help that they need. Let's do the video, and then I want to bring up Professor Mills to actually talk about what they found in the report and some of the specific recommendations. I will then relate the recommendations to our specific budget actions. We'll have Senator Jackson appropriately finish up to bring it back to why this is so real. First, the video. Thank you.
Lorenzo is my third child. He's very giving and caring, take him to church, typical boy. But about age 10, 11, he didn't mingle with a lot of friends. He always started to be by himself. So one day I came home from work and he came in and said, "Do you hear them? They're trying to come in and get me." So I went outside and I looked, I didn't see him. First thing came to my mind, he's messing with drugs. Turned the stove off, grabbed him, took him to Kaiser Emergency, and I told him what was told me it was psychotic schizophrenia. Got to the point where I was afraid to have him at home because he had a little sister. Because one minute he was fine and then he was on the street.
Things were hard for me, and I used to break into the storage locker rooms to sleep in the storage units just because I didn't want to be sleeping on the streets.
Imagine going into a jail cell or into a court system where you don't understand what's happening, everything's happening quickly, the lights never go off, it's loud, it's dangerous, it can be violent. The thought of putting someone who has serious untreated mental illness into that situation it's horrific.
I couldn't sleep. Every day I'm worried, wondering if he's okay, if he's still alive.
There are many places in the country where there are few, if any, community-based mental health resources available to people, and the criminal justice system becomes the only response that a community has to somebody who's suffering from serious mental illness.
And it's plain uncaring to use state prisons and hospitals as the first resort instead of the last resort for people who could have better lives if only we stepped forward and did the right thing.
I'm going to give you some things to think about, Phil, and that is, what is the follow-up, kind of like what are those next steps to keep you in the place you're at right now?
Behavioral health court is where we offer treatment instead of traditional criminal prosecutions. They will receive the treatment, which also comes with a host of services that they would find difficult to get out in the city: housing, education.
Good morning, Your Honor. Susan Christian.
So it's a win-win.
The advent of mental health courts is really one of the bright spots in this otherwise very dismal story. The idea of a mental health court is a very positive first step in a broader recognition that simply putting mentally ill people in prison is not a humane and not an effective response to this problem.
He's made all of his appointments, taking his meds.
It hasn't been easy, but we've figured out what it takes to help someone learn to manage their mental health symptoms in the community and have a quality life that they clearly weren't having before when they got arrested.
The vast majority of people who go to prison or jail are getting out. And all of the studies show that if you provide mental health care and treatment to people, the rate of committing other crimes goes down dramatically.
In the years that I have known Lorenzo, that he's been out of custody, he's never had a single bad report. He's done extraordinarily well, and now he's in school to become a medical tech. I mean, for me, isn't that what we want?
For 26 years I've been praying for help for him. And then here came this program. They solved the real problem. And they helped me and my son, and now I have my son back. And I'm so grateful.
Please read our report and find out how you can take action by going to www.camentalhealthreport.com.
So I'm David Mills. I teach at Stanford Law School. I'm actually not the director of the Three Strikes Project. Mike Romano is. And we acknowledge Mike. But I want to acknowledge Katie and Kelly and Ann. The film is just one step of enormous amount of work Katie and Kelly and their team at Latera Films have done in terms of helping us visualize the problems of incarceration in California, and acknowledge also my partner and the driving intellectual force behind almost everything we do, my partner and wife, Ann. But I want to talk just a little, and I'm going to avoid the rhetoric. Some of the rhetoric did make its way into the report. I couldn't help myself. Because we do face a true era of segregation of mentally ill, and we're hiding them. We hid them behind mental health facilities in the 19th century. We hid them again in the 20th century, and now we're hiding them in our prisons. But before I go there, I want to really thank and feel some degree of optimism because Senator Steinberg, Senator Hancock, Senator Bell, Senator Jackson, and all their colleagues, but I must acknowledge Senator Steinberg in particular because he has been the real leader here and really do appreciate it. So years ago, we changed our prison system and we decided that prisons were the appropriate place to not only incarcerate but to exact vengeance on the folks who have acted in an appropriate manner. Maybe that was right, maybe that was wrong, but that was the reality. And the vengeance model took over from the rehabilitative model. And in addition to that, we decided that longer and longer prison sentences were appropriate. And as a result, we saw reality. We saw folks who were of color, a substantial number of whom were the disproportionate number of folks who were in prison. We saw folks who were poor and who could not otherwise find their way in society, also in prison, perhaps understandably. Unsurprisingly, but perhaps not intentionally, we also saw that prisons became the place where the mentally ill were being hidden. Because we closed our mental hospitals, because we deprived the communities of the support they needed to continue the community-based mental health services for which California had in fact been the leader, the consequence was, as the senator pointed out a few minutes ago, dramatically increased prison sentences for mentally ill folks. And these folks do express their mental illness many, many times through the commission of crimes. Some of them are horrific. And perhaps that is an appropriate place to place some of these people, but not all of them. And after we passed Prop 36, and our group worked really hard to get that done, one of the things that struck me as we began to examine the prisoners who were getting released was the staggering number who are mentally ill. And we tried to figure out, what are we going to do with them? And we looked for mental health services that we could provide to them upon release. And one after another, the reality was that there were no significant mental health services for many of these folks. We ran into all kinds of roadblocks. For example, you have a prisoner who's released from prison, he's on medication. He doesn't remember his medication. He doesn't know his medication. We go back to the prison, tell us what his medication was. We can't. We don't know. The records are gone. So he no longer takes his medication. What's going to happen? He's going to end up back in prison. That's the reality of today. So we have a dramatic number of people in prison and being released from prison who have serious mental health concerns. The number is 45%. Is that right, Mike? 45% of our prisoners have some form, some very significant and serious form of mental illness. And what we learned when we did our summary, when we did our review, when we did our report, what we learned was that the mentally ill are disproportionately sentenced, meaning that they get significantly higher sentences than the non-mentally ill folks who commit exactly the same offense. Why? They're scarier. They're more worrisome. But that's the reality. They get higher sentences. They get disproportionately mistreated in prison in the sense that they behave poorly in prison. Why is that a surprise? One of the things we learned in the 19th century by studies from the great sociologists of the era and the mental health reformers was that mentally ill people react much poorer, much worse when they are in confined spaces. So what do? We put them in confined spaces. So we have disproportionate treatment in the disciplinary system. Many, many more prisoners are subject to harsher disciplinary treatment if they're mentally ill. What else do we learn? We learned that there was disproportionate denial of parole. There's disproportionate denial of being released under any circumstance, meaning that the parole system did not and would not allow them to get released, again, probably out of fear, because there's nothing else to do with them. But of course, that's not true. And finally, after passing Prop 36, we found, unsurprisingly, that although we were and have been enormously successful in seeking the relief of many of the folks who were sentenced under 3 strikes for nonviolent crimes, the ones who were not being released were, again, disproportionately mentally ill. So as a result of that, we decided to look at the system, and we come up with 3 concrete, semi-concrete proposals. I say semi-concrete because there's no legislative language yet, but we're working on it. But the 3 concrete proposals are the obvious ones. One is to deal with prisoners who are with folks who have been convicted of a crime and are being sentenced. We are suggesting, urging, that the California legislature enact legislation that the judges are required to take into account the mental health impact on the mental health reality or the mental health cause of the criminal act. And if the criminal act was caused by mental health concerns or mental health issues, and the act was not violent, then we are proposing that these folks be diverted from the prison system into mental health care facilities, that they not be automatically sentenced to prison just because of the act when that act was driven by a mental health concern. We are further suggesting that once someone is imprisoned, that when a judge sentences someone to prison because either the act was violent or for whatever other additional reasons is necessary to sentence someone who has mental health issues to prison, that there be a suggestion, a semi-requirement, if you will, that these folks receive mental health treatment while in prison. We don't have any clear, unambiguous technique for making certain that folks who have mental illness, who are subjected to mental illness, are being treated properly in prison. We are suggesting the adoption of a mental health oversight court or board, which will make certain and track these prisoners so that these specific folks who need mental health treatment will get it while in prison. We're not trying to take away from the prison and the prison system their difficult, and to my mind, horrible task of having to deal with the prison population, particularly with the overcrowding. But we're suggesting that the prison system will work with this court to make certain that the treatment that they're getting is the appropriate treatment, so that they can begin to undertake to have somewhat constructive lives where it's possible. And maybe, just maybe, we'll be able to convince the prison system that being involved with the disciplinary proceedings while they are ongoing in prison can be integrated into the mental health oversight court. Finally, and an issue that's near and dear to my heart, we are suggesting that folks who are released from prison have mental health evaluation 30 days prior to the release, and that they be referred, when appropriate, to a mental health facility after release. We have learned in Prop 36, because we work with almost all the prisoners who are released, that we can reduce recidivism by working with the prisoners who are released. Our recidivism rates are about 1.5%, and the general population recidivism rate is somewhat 15 times that, if I have that number right, or 14 times that. So we are suggesting that upon release, prisoners be provided additional mental health facilities so that they will not, or they will be less likely to recommit a crime. Now, when we did Prop 36, and I'm going to end with this, when we did Prop 36, the one thing we learned, we started with the notion that people are going to do this because it's going to save them money. The California voters in our polling told us something very different. What they told us was that they wanted to do this because it's not right, it wasn't fair. That sending people to jail for the rest of their life for stealing a piece of pizza just didn't make a whole lot of sense. It wasn't right, it wasn't fair. We believe that the prison system today, the California voters again will recognize that the unfairness of using prisons and harsh treatment to treat mental illness is out of a 19th century model, not a 21st century model. And that it's time to change that. We've discovered it. We can provide the statistics. Our team is ready, willing, and able to work with the Senate and the Assembly to do whatever it takes to help implement these and other programs in order to reduce and help the treatment of the mentally ill who are now languishing behind the walls of our prison system. Thank you very much. Hope I didn't talk too long.
No, you're kidding. I could have listened for another hour. because it's that compelling and that important. Before I turn it over to Senator Jackson, I know the first question you rightfully will have. What are you doing about it? As a reminder, last year, one of the controversies, actually post-state budget, was what to do about prison overcrowding. The Senate took a particular stand during that debate, and the result was Senate Bill 105, which said that every dollar that doesn't have to go into leasing jail cells, in-state or out-of-state, by virtue of receiving an extension from the federal court, can then be plowed into recidivism reduction. The governor proposed $90 million for that recidivism reduction fund in his January budget. He maintains it in his May revision, and the Senate adds, I believe, an additional $40 million. And so the answer to the anticipated question is we intend to start right now, over the next 3 weeks, to begin implementing the proposals in Professor Mills, Mr. Romano's, and the Three Strikes Project's recommendations. And let me be a little bit specific about it. To reform the way we sentence the mentally ill, we are proposing establishing a competitive grant program to expand the number of mental health courts we have in California, like the one featured in the short video. We would fund it at $20 million through existing resources in the Recidivism Reduction Fund, which would allow us to expand to how many courts? Over 20 at least. We propose reestablishing the Mentally Ill Offender Crime Reduction, otherwise known as MIOCR, grant program, which was once successful in reducing reoffending rates among people with mental illness. You start the wraparound, the mental health care and treatment in the jail or prison, and then you continue it without interruption once that individual is released. We would fund it again at $50 million through the Recidivism Reduction Fund. To provide meaningful treatment, we propose repurposing $12 million of existing law enforcement funds to support innovative police training designed to enhance officer competency and safety in dealing with the mentally ill, substance abusers, or homeless. This is the beginning of that discussion we started yesterday on our floor and that is taking place throughout the country now about how we can equip law enforcement on the front lines to understand and detect the signs, and then to have a protocol to intervene more assertively where appropriate. We also propose, along with the administration, expanding substance abuse treatment to 10 institutions that do not have reentry hubs, $11.8 million out of the general fund. We propose, along with the administration, some of this is not just us, the administration as well, reentry programs targeted at offenders with mental health diagnosis. We would fund it to $25 million, again through the same fund. And finally, we propose, along with the administration, what's known as additional funding for the ISMIP program, Integrated Services for Mentally Ill Parolees, which provides an array of mental health rehabilitative services to parolees facilitate independent living. And we would fund that at $11.8 million, again through the Recidivism Reduction Fund. This is a beginning, but an important beginning, and may we succeed, and then build upon that for the many unnamed, the known and unknown people out there, and potential victims of crime as well in the future, so that we might, one, avert tragedy, and two, might help people lead better lives. Senator Jackson.
Well, I too want to thank Senator Steinberg for his leadership. He's been very actively involved in this issue as long as I've known you, back in 99 when we started serving together in the Assembly. And I have been supportive of those efforts, but it isn't until you actually see it and feel it that sometimes you are moved to speak up as loudly as humanly possible. And as many of you know, on Friday, a young college student killed 6 innocent people and injured 13 others, and then took his own life on a horrific and murderous rampage in my district in the community of Isla Vista, which is immediately adjacent to the University of California at Santa Barbara. There's much we're still learning about this young man who committed acts of unspeakable violence and law enforcement's interaction with him prior to this tragic event. There were so many potential moments where this behavior could have and perhaps should have been identified in advance so that we would not have 6 families mourning the losses of their young hopeful children. There are 13 people wouldn't be lying in hospital beds or recuperating from gunshot wounds or being run over by this young man's mental illness. And I think what I would like to focus on is that we talk about what to do with people who are incarcerated and when they come out. So I want to focus on the victim. How do we stop this before it happens? This was a young man whose mental illness was right out there on YouTube and right out there on Facebook and in screeds that he posted on blogs, and yet no one did or was able potentially to recognize the behavior, the potential for violence that resulted in this mass set of murders. I think what has become significantly clear in my district, and I think when we hear that 45% of the people in prison are mentally ill, is that mental illness isn't some distant, abstract issue that impacts somebody else, that happens somewhere else. So I think it is time that we recognize and pull mental illness out of the shadows and destigmatize it so that we can treat it, so that we can put in the necessary funds to try to deal with this. The notion that our law enforcement went out to his home without potentially the full panoply of resources and services available to identify this young man as he was fomenting this hideous crime, to be able to investigate, to be able to search his apartment. They would have found 3 weapons that were used as part of this plan, to be able to pull him in and perhaps treat him, or at least identify his murderous ideations, to be able to recognize that this was a young man about to go out of control. And yet, do we have the resources? Do we have the ability to do this? We saw this, and it happened in a homeless man who was confronted by police. They didn't recognize his mental illness, and they beat him to death. Could they recognize the behavior of this young man who presented himself apparently in perfectly reasonable, rational health? Were they trained? Can we do better? And the answer is, we must do better. We must do better. And so I recognize that our law enforcement makes tough calls every day. But I also recognize that we do not do enough to train them, to have professionals amongst them who can recognize these symptoms so that we can stop the violence before it happens, so that we don't end up having 20,000 people in the local stadium out at University of California yesterday in Santa Barbara attending a memorial service for 6 people. This event has hit my community very, very hard, and rightly so. And so we have to ask, what can we do to stop this behavior? We have research and reports from some of our finest educational institutions. We know that mental illness is part of the overall treatment that police officers get, but it isn't enough. And so I'm pleased that with the leadership of our President Pro Tem and the members who stand with me today, that we are going to put more money into this process. We have to continue doing that so this kind of violence ends. Thank you.
Thank you. Very good. I know that my Senate colleagues and I need to get back to the Senate floor momentarily, but we would be happy to answer questions, and I hope most of them are directed to Professor Mills here, but that's up to you. We'd be happy to answer your questions. Hi.
What kind of training right now, how many hours of training right now do frontline police officers get dealing with mental health?
As I understand it, and I'm going to look for cues. By the way, I want to give some kudos to my team led by Darby Kernan here, who worked with Michael and David to help put this report together. Thank you. The post-training, which is the standard training for law enforcement officers, does include how to identify somebody, how to deal with somebody who's exhibiting mental illness. But as I understand it, it's an elective, if you will, part of the post-training. It's not required. And it's obviously not as intensive as it needs to be. When I talk about protocol, what do I mean? And again, I don't second guess, because to me the Santa Barbara situation, people do the best they can, and they're taxed with a whole lot of responsibilities. But I think we can, without being critical necessarily, we can look at situations and let it instruct what we need to do going forward. We asked yesterday on the floor, and Senator Jackson, I think, asked again, so with the YouTube rant in the video, the mother calling, the 7 officers going to the door, the guy appears calm and in control. Why is that the end of the evaluation? Why don't we have the protocol, that's the word I keep using, the protocol in California and the training that says in that sort of a situation, you're going to talk to neighbors, you're going to talk to roommates, you're going to check the dealer record of sale of the gun purchases just to make sure that individual hasn't recently purchased guns. So there's a lot more we need to do in addition to the resources. And I know this is the dominant question appropriately given what's occurred. But again, I want to emphasize the vast majority of people don't commit mentally ill, don't commit violent crimes. Even the people that Professor Mills and Professor Romano and others studied aren't necessarily violent people. They're people who committed property crimes or so-called quality of life crimes. So we just don't want to overgeneralize here, but I think that's really, in terms of this incident and what we can learn and the training for law enforcement, it needs to be much deeper, and the protocols need to be a lot more intensive and well and understood and across the board. Other questions? Yeah.
Does the Senate have any plans to bring back any gun control legislation that was approved last year?
You know, I don't think we're going to focus on that in these last months. Look, you know where I stand on these issues. I introduced the assault weapon, closing the loopholes on assault weapon ban last year. My colleagues introduced other measures. The governor signed some of them. He vetoed my bill. That was unfortunate. But, you know, I'm into the arts of the possible here. And somebody will bring that bill back, by the way, at some point after I'm gone, and it will someday become the law. But in the meantime, we want to focus on this agenda.
Can you summarize, Senator, and outline the money again, how it will pay for this? So it's all existing.
Most of it is money from a pot of money that the governor himself has put forward as a result of our SB 105 last year. We've upped the money by about $40 million. He put in 90 or so. 91. We upped it to 132. I want to be exact here, to the penny. We upped it to 132. So we have a little bit of a difference as we negotiate, and we're going to try to accommodate as many of these proposals outlined today with as much of that money as we can get in the budget. And again, it's collaborative courts, it's the mental health courts, the reestablishment of the mentally ill offender crime reduction grant, which are services in jail and prison, but continuing out of jail and prison. There's the training, which we've just talked about. There is the training of frontline law enforcement, we've talked about, expand substance abuse treatment, the reentry, more of an emphasis on reentry that includes transitional housing, again, suggested by the governor as well. So we intend to make a deep commitment to addressing the recommendations in this report, but let's be real clear. There's a lot of ground to make up here and a lot of years. But I'm hopeful that if we focus now on the criminal justice system, you match it with the Prop 63, the Mental Health Services Act, the crisis what I call the infrastructure of the system, the crisis beds and the crisis workers, more training for law enforcement folks, we begin to fulfill that promise that was made when we deinstitutionalized in the late 1960s, that we would build a decent system of community-based mental health care and treatment for people who need it, so that mental illness is not a life sentence of unemployment, hopelessness, homelessness, and cycling in and out of jails and hospitals. Thank you very much. Gotta go. Appreciate it. Go ahead.
Can I add that we have significant savings from Prop 36? How much is it, Mike?
70 million.
Yeah, so right now, we believe we can demonstrate that we have saved the state $70 million by virtue of the folks we've had released under Prop 36. That would be a good source of funds to help pay for the mental health needs of the prisoners. We believe that number is going to increase dramatically. We believe further that providing mental health facilities, it's hard numbers to prove. It's a difficult issue because it's proving a negative. But we believe there will be significant savings, that these programs more than pay for themselves. But we have a simple number. $70 million has already been saved by Prop 36.
On top of the 90 that we're already, or the 130 we're already talking about. So.
Thank you very much.